What wet food is best for cats with chronic kidney disease? Sadly, kidney disease is very common in senior cats, in particular chronic kidney disease or CKD. Unfortunately, there is no cure for chronic kidney disease, so treatment is aimed at both improving quality of life and slowing the progression of the disease. Diet is a very important and clinically proven part of the management of kidney disease. So let's explore what food is best for cats with kidney disease. Well, firstly, what is chronic kidney disease? Well, the kidneys have many important jobs within the body. They filter waste products from the blood, they produce urine, they produce some hormones, and they also play a role in maintaining fluid balance, electrolytes, pH, and blood pressure. In chronic kidney disease, there is an irreversible loss of kidney function over a period of time. This can be caused by many factors such as cystic disease, infection, inflammation, toxins, tumours, or more commonly, the cause can be unknown. CKD can happen at any age, but it usually occurs over the age of 7 years. So what are the symptoms of chronic kidney disease we should be looking out for? Symptoms of CKD include drinking and weeing more than usual, because the kidneys can no longer concentrate the urine, lethargy or being more tired than usual, nausea and or vomiting, since the kidneys can't effectively remove toxic waste products any longer, so they build up in the bloodstream, reduced appetite and weight loss, high blood pressure, pale gums due to anemia, a lack of red blood cells, smelly breath, a poor quality coat. It is thought that up to half of cats over 15 years old will have some degree of CKD. So how is chronic kidney disease diagnosed? CKD is diagnosed by a combination of blood and urine tests, and possibly some imaging of the kidneys. Blood tests detect toxic waste products building up in the blood, among other things, and urine tests assess how well the kidneys can concentrate the urine, and they check for infection. Your cat's blood pressure would also need to be monitored. So how is chronic kidney disease treated? Well, sadly, there is no cure for CKD, so treatment aims to improve quality of life and to slow the progression of the disease. Amongst other things, this involves ensuring adequate nutrition, maintaining good hydration, normal electrolyte and pH balance, normal blood pressure, and minimising the toxic waste products building up in the blood. This is mainly achieved through a combination of diet and medications. So what can I feed my cat with kidney disease? Well, feeding an appropriate diet is one of the most important aspects of managing CKD. So what should we be looking for in a cat diet for CKD? Well, firstly, water. The kidneys control how much water there is in the urine. In a healthy cat who has not drunk enough water, the kidneys will concentrate the urine to compensate for the low water intake. This means they would keep more water in the bloodstream rather than excreting it in the urine to prevent dehydration. In CKD, the kidney's ability to concentrate the urine in this way decreases, so the cat becomes gradually more dehydrated. This means we need to make sure that cats with CKD are taking in plenty of water, and wet food is a great way of increasing a cat's water intake, since wet food tends to contain around 75% water. Wet food also tends to be more palatable or tasty than dry food, plus it smells better. This means that wet food is often a better option than dry food for cats with CKD, who may have a reduced appetite or be feeling nauseous. Next, phosphorus. Feeding a diet with restricted phosphorus is very important in CKD, since high levels of phosphorus in the blood, which is known as hyperphosphatemia, is associated with a faster rate of disease progression. It is estimated that more than 60% of cats with CKD have hyperphosphatemia. Low phosphorus diets can therefore limit further damage to the kidneys and possibly prolong life expectancy. Low phosphorus diets can also help to reduce nausea. Diets containing chicken and some types of fish as their protein source are often lower in phosphorus naturally. As a general rule, diets for cats with CKD should contain around 0.3 to 0.6% phosphorus on a dry matter basis. Another option to reduce phosphorus content is by giving intestinal phosphate binders by mouth, which your vet may prescribe. However, giving anything by mouth to a cat with CKD can be very stressful for both the kitty and their pet parents. Adding something to the food of a cat who already has a reduced appetite may also put them off their food even more. So phosphate binders are often reserved for when blood phosphate levels increase despite a phosphorus-reduced diet, or for cats who will not eat a phosphorus-restricted diet. Protein. Adequate protein intake is essential to prevent muscle wastage and weight loss in cats with CKD. However, most of the toxic waste products circulating in the blood in CKD come from the breakdown of food protein, which the kidneys are no longer able to process. So a build-up of these toxic waste products causes nausea and sickness. We can reduce the waste products circulating in the blood and therefore improve quality of life by reducing the protein content of the diet. The key is to feed a diet with restricted protein, ideally around 28 to 35% on a dry matter basis, but it needs to be high quality protein, which is easier to digest and will help to maintain muscle mass. The exact amount of recommended protein will depend on which stage of CKD your cat is in. For example, cats with end-stage CKD should have much less protein in their diet than those in the early stages. Reducing protein also helps to reduce the total phosphorus levels of the diet, since many meat-based proteins have a high phosphorus content. Next, calories. To compensate for the restricted protein, diets with CKD often need to be calorie dense. Higher calories compensate for the smaller appetite and help to reduce weight loss. Calorie-dense diets are often also more palatable, so more tasty, and tend to smell better to our feline friends. The exact calorie needs will vary depending on your cat's weight, body condition, and again, their stage of CKD. Sodium. Diets high in salt are not suitable for cats with CKD. You need less than 0.4% salt content on a dry matter basis. Diets with mildly restricted sodium can help to manage high blood pressure associated with CKD. And potassium. Low blood potassium levels or hypokalemia is common in cats with CKD. This is because the kidneys are not working fully, so they excrete more potassium than they should. Because of this, some special kidney diets provide higher levels of potassium than regular diets. However, any potassium supplementation, whether it's through the diet or by mouth, really ought to be tailored to each cat's individual needs. This would be done by your vet, who would take a blood sample to assess potassium and advise you if any supplementation is indeed necessary. Omega-3 fatty acids. Omega-3 fatty acids are well known for their anti-inflammatory properties, and they may well have a protective effect on the kidneys. Omega-3 fatty acids therefore may help to maintain blood flow through the kidneys and to reduce any inflammation. Ideally, a diet for a cat with CKD would contain good quality omega-3 fatty acids at 0.4 to 2.5% on a dry matter basis. Antioxidants. Antioxidants such as vitamin C and E may help to protect the kidneys against any more damage. And lastly, fibre is also important. Soluble fibre can help to promote healthy bacteria in the colon. This helps with the elimination of waste from protein breakdown through the stool. It can also help to prevent constipation, which is very common in cats with CKD. So, final thoughts. If your cat's been diagnosed with chronic kidney disease, it's perfectly natural to feel anxious. Unfortunately, the prognosis for CKD is highly variable. Your vet will be there with you to guide you through each stage and will advise you on how to best manage the disease. Remember, the exact nutritional needs of cats with CKD will vary on a case-by-case basis, and your vet will be able to advise you. While all these nutritional guidelines are important, there is nothing more important than ensuring that your cat is actually eating. If your cat is not eating or is not eating enough, then the effects of weight loss and muscle loss will be worse than the effects of them eating their usual diet. So while there are special kidney or renal diets formulated for cats with CKD, some are even tailored to specific stages of the disease. However, some cats won't eat specially formulated kidney diets, and in this case, some regular diets will also meet the criteria for cats with CKD. It's really important that you check with your vet if a particular diet is suitable for your individual cat's needs and the stage of CKD that they're in.